Big changes to the Pharmacare program in this country. We have Manshadi joining us to help break it down and what it means. Welcome back to the show.
Thank you for having me.
Yes, it's great to have you. Do people need to be aware of what's going on?
Absolutely. There's it's going to be a big impact on a large number of people. So this segment will help them to deal with the new issues that is coming up.
So there are many drugs that people could be on that will be affected, and we have 3 different sets of drugs that we're going to just quickly look at, because a lot of people that you deal with, for example, are on some of these types of drugs, things like high cholesterol drugs.
Yeah, these are the drugs that many people are taking. And as of December 1st, 2016, high cholesterol drugs such as fluvastatin, lovastatin, pravastatin, and simvastatin are not going to be fully covered.
And they are right now.
They are right now. And as of December 1st, 2016, is going to be only rosuvastatin and atorvastatin, means Crestor and Lipitor.
Okay.
So similar, there are drugs that affects the stomach acid, and these are those drugs. If people are taking these drugs, as of December 1st, again, these drugs are going to be partial coverage.
Okay.
And the next, same thing, they are high blood pressure drugs, and also for heart disease. These are some of the drugs that we are giving to our patients. And same thing, there's going to be partial coverage that is going to affect a lot of people.
So what do people need to know? They need to know what their options are. And I know that you've sent along some options that people need to consider should they be affected.
So obviously, this is very important for people that they are on fixed income, or they are lower income, and they have social assistance. These people obviously going to be the greatest impact. They have perhaps to switch the drugs to this what it is going to be covered, or they can stay on this drug and pay the difference.
Okay.
So, you know, that is another option they can do. And the third option is they go to their nurse practitioner or their doctor, and they get a special authority through the Pharmacare, but they have to have a medical reason for it, and then the government will pay for it.
Okay. So what is the idea behind these changes to Pharmacare? We quickly talked about this during the break. What is the large-scale plan here?
Well, Pharmacare would like to save approximately $27 million for the next 3 years. And the goal is perhaps they can use this money and spend it on more innovative drugs. Because some of these drugs actually, when we do switch, are safe and effective. So it's not going to have a big impact on the patients when we do switch them.
So people shouldn't get too worried that things are going to really change for them?
I don't think they should be. I mean, we are going to monitor, and we will change it in a way that will be the same strength and same level of effectiveness. We will definitely monitor that and making sure that everybody is looked after. Yeah,
so these changes set to take effect December of this year, is that right?
Yes, December 1st, 2016. Most important thing is right away we need to seek out help through your pharmacist, through your nurse practitioners, and the doctors to see if you're affected. If you're affected, we need to move fast because when we change the medication, obviously we have to monitor and making sure that everything works out for them.
Smooth transition is
important. And they don't have any side effects and so forth.
Fantastic. Misa, thank you very much for being here today.
Thank you for having me.
Yeah, very welcome. Important information here, and on the screen we have manshadipharmacy.com. I believe we also had the government website where you could go for more information. But if you do have questions, you can certainly phone Misa, talk to him or one of the people at his 2 offices, 2 pharmacies. Information on the screen. We're back in 2 minutes. Stay with us.